Clinical case simulations in Semester 10. A comprehensive explanation. Clinical case simulation is a learning method designed to develop medical students' clinical skills comprehensively before they encounter real patients. In the 10th semester, medical students utilize clinical case simulations to enhance their skills in diagnosis, decision-making, patient communication, and medical intervention application based on clinical scenarios that closely mimic real-life situations. 1. Definition of clinical case simulation. Clinical case simulation is a scenario-based learning process where medical students are presented with clinical situations designed to replicate real medical conditions. During these simulations, students are expected to identify the patient's health problems, analyze symptoms and clinical signs, make accurate diagnoses, develop effective management plans, communicate professionally with patients and the healthcare team. 2. Objectives of clinical case simulations. A developing clinical competencies. 1. Diagnostic skills. Analyzing symptoms and examination findings to make precise diagnoses. 2. Clinical management. Designing treatment plans based on evidence and considering patient conditions. 3. Decision-making skills. Learning to select appropriate interventions under time pressure. B. Enhancing non-technical skills. 1. Effective communication. Learning to communicate with patients, families, and healthcare teams. 2. Team collaboration. Training in teamwork within a multidisciplinary team to ensure optimal healthcare delivery. 3. Empathy and medical ethics. Applying professionalism and ethical values in patient care. C. Reducing real-world errors. Simulations provide opportunities to learn from mistakes in a safe environment without risking harm to actual patients. 3. Components of clinical case simulations. Clinical case simulations consist of several components designed to create a realistic learning experience. A. Clinical scenarios. Scenarios are based on real medical cases, such as patients with high fever, chest pain, or physical trauma. They may involve acute, chronic, or emergency conditions. B. Use of simulators or standardized patients. 1. Medical simulators. Advanced simulation tools like mannequins that can mimic vital signs, physiological responses, and specific medical conditions. Example: simulators for cardiopulmonary resuscitation, CPR, or intubation procedures. 2. Standardized patients. Actors trained to portray patients with specific medical conditions. Helps students practice communication and physical examination skills. C. Supervision and feedback. Simulations are supervised by instructors or medical mentors who provide direct feedback after the session. D. Performance evaluation. Students' performance is assessed based on technical aspects, diagnosis and clinical management, and non-technical aspects, communication and teamwork. 4. Stages of clinical case simulations. Clinical case simulations in Semester 10 are typically conducted in several stages. 1. Orientation. Students are introduced to the scenario, learning objectives, and their roles in the simulation. Example: explanation that the student will face a patient with acute chest pain symptoms. 2. Simulation execution. Students perform their roles as doctors in situations that mimic real clinical conditions. Examples of activities: conducting anamnesis and physical examinations, ordering supporting examinations such as EKG or blood tests, making a diagnosis and treatment plan. 3. Debriefing after the simulation. Mentors provide feedback on the student's performance. Students discuss the steps taken, errors made, and solutions for improvement. 4. Evaluation and reflection. Students are encouraged to reflect on their experiences, learn from mistakes, and plan for future improvements. 5. Types of clinical case simulations. Acute condition simulations focuses on handling emergency cases such as heart attacks, anaphylactic shock, or head trauma. Involves quick and precise actions in critical conditions. B. Chronic disease simulations. Managing patients with conditions such as diabetes mellitus, hypertension, or chronic kidney disease. Focuses on long-term management and controlling complications. C. Medical procedure simulations. Students are trained to perform specific procedures such as venipuncture, catheter placement, or endotracheal intubation. D. Communication simulations. Students practice providing medical information to patients, explaining diagnoses, or delivering bad news, breaking bad news. 6. Examples of simulation scenarios. 1. Acute chest pain case. A patient presents with chest pain radiating to the left arm and shortness of breath. Students are expected to conduct anamnesis and physical examination, order an EKG examination, identify acute myocardial infarction and provide initial therapy, nitroglycerin, oxygen, aspirin. 2. Fever in children case. A 5-year-old child presents with high fever for 3 days and a rash. Students are expected to identify possible dengue fever or measles, order supporting tests such as a complete blood count, provide a treatment plan based on the diagnosis. 7. Benefits of clinical case simulations. 1. Boosting confidence. Provides hands-on experience, making students feel more prepared to face real patients. 2. Minimizing risks to real patients. Students can learn from mistakes without endangering patients. 3. Developing multidimensional skills. Integrates theoretical knowledge, technical skills, and communication abilities. 4. Progressive evaluation allows for objective evaluation of students, helping identify areas for improvement. 8. Challenges and solutions in clinical case simulations. Challenges 1. Limited facilities. Not all institutions have adequate simulators or standardized patients. 2. Student rigidity. Some students may feel awkward during simulations. 3. Time constraints. Simulation sessions are often not long enough to explore cases thoroughly. Solutions 1. Investment in technology. Developing simulation centers with modern tools. 2. Repetitive practice. Providing more frequent simulation opportunities to increase students' comfort. 3. Improved mentor support. Mentors are encouraged to provide more in-depth guidance. 9. Conclusion. Clinical case simulations in Semester 10 are a crucial learning method to prepare medical students for real-world clinical challenges. Through these simulations, students can hone their technical and non-technical skills in a safe and controlled environment. By working on realistic scenarios, they learn how to diagnose, manage, and communicate effectively, making them more competent and confident when dealing with actual patients in the future.